Hi, my name is Heather. I'm 54 years old, and in November of 2021, I was diagnosed with squamous non-small cell lung cancer. It had progressed as far as my adrenals, my lymphs, and as far as my hip, stage 4. My initial diagnosis came really out of the blue for me. I was planning to go out of the country with my family on vacation before the holidays, and I had this just odd throat clearing when I would snuggle down in my bed at night before I went to sleep, and it just felt different somehow. So I wanted to get my booster shot for COVID, and before doing that, I wanted to make sure I didn't have any lung engagement. So I went to the doctor, and I couldn't have been more surprised when I came back with a 6 centimeter mass in my lung. All of the doctors were very encouraging, that they were very certain that it probably wasn't going to be anything at all, because I was not in a very high risk category. I was young, I was a non-smoker, I had been leading a fairly healthy lifestyle because of my rheumatoid arthritis to begin with. So I had been treating that with supplements and healthy diet. So it was very, very surprising to me when the news came back that I had stage 4 lung cancer. Immediately, you jump on the traditional bandwagon. I'd always trusted my doctors. I really hadn't had very much opportunity to go to doctors until somewhat recently. But I just dived into the traditional protocol of chemotherapy. I was tested for mutations. I had an unusual mutation for lung, but not one that there had been much research done on, and there weren't a lot of drugs that were approved by the FDA to treat that particular type of mutation. So they gave me what they could, and thankfully I was a person that didn't have a whole lot of side effects from chemotherapy. Certainly I had odd things like bloody noses and fatigue, and I lost all my hair. Food didn't taste quite right, but I was able to continue researching because it was clear to me that things were not working very well, and my tumors were not diminishing at the rate that we had hoped. I was also on immunotherapy, a drug that was they had a lot of hope for, because I was high in a certain type of a certain level that apparently boded well for this particular type of immunotherapy. At the end, my body had just had enough, and I ended up in the hospital for a couple of weeks. That's the first time I'd really felt poorly, and they said, no more chemo for you, and we really just don't have anything else for you at this time. We're going to leave you on immunotherapy and really just hope for the best, it sounded like. So I immediately had a metastases to my liver. And I am so grateful that I felt fairly good during my traditional chemotherapy early rounds, because I had done research. I had read 100 books probably. I had talked to a lot of people. I had learned a lot about what felt like almost like a subculture of cancer, which was the metabolic approach to treating cancer. There were words like off-label drugs, phrases like off-label drugs that became known to me. I realized that there was more medicine and more treatment that were available outside of what was available through traditional medical practitioners. And so I had talked to a lot of people, and I'd had a lot of video consults. Most of them were relatively uninformative. If it was a traditional care facility, they would tell me the exact same thing every time, no matter how much money I paid or how many things I sent over to them about my particular case. But when I found Dr. Virginia von Schaefer, a VVS MD, she was the single most prepared person whom I visited with throughout this entire time. Some doctors, it seemed like, were just looking at my materials for the first time when we were on our video call. Dr. von Schaefer had reviewed everything very thoroughly. She had a plan. She was able to explain things to me that had been puzzling to me in the past, like why aren't we, treating cancer with supplements and things that might not be available through traditional medicine, and you know what's the science behind all of this. And she was just incredibly informative. She was very, very kind, and she had a sense of urgency to her that I really appreciated a lot. I think that comes from her 30 years as a trauma surgeon. And I had a sense of urgency to me, because that's one thing cancer patients don't have, is a lot of time. And so when she shared with me about this chemo cocktail that would be compiled after I had done some testing to see which available chemo drugs would be effective on my particular type of cancer. Of course, that's outside of the body, and our bodies are broken, so there are no guarantees, but at least we're starting with drugs that outside of the body appear to be effective on an individual's particular cancer. So a cocktail of those drugs, those chemotherapies, are put together, and I was treated with that. It was wildly successful. And when I explain this to people, I always say, if you're going to apply to a college, you're not going to apply to just one, right? You're going to apply to several colleges that you're interested in the hopes that you'll get into one. And that's really the plan with the cocktail, is that, you know, if you do 4 or 5 different chemotherapy drugs simultaneously, that a couple of them, maybe more, would be effective and you'd have results sooner. Again, in the interest of time. In addition, my immune system was supported with other adjuvant therapies that are available at VVSMD. The supplements that I was sent home with after my stay here out in California, where I was treated for 7 weeks initially, and I have an at-home protocol that I'm able to maintain on my own now. Initially, I thought that a cancer journey was straight up, right? You either, or down, you either go straight up and you're healed, or it doesn't work and you're not. But I've come to realize that there are ebbs and flows, and you get to a certain point in the journey, and you have to be retreated or change the formula a bit, and then you go up a little higher, and then something happens again, because our bodies are very fragile but also very resilient. And I have found that VVSMD has been an incredible support in that journey, that Dr. Von Schaefer understands the process of how to move us toward, in my case right now, it's the dendritic vaccine, the treatments that will ultimately give us the best hope of some kind of remission or living with cancer long term. Because I do believe that with what I know about cancer as a metabolic disease, not just something that can be cut or poisoned or burned, but that must be treated at the cellular level in order to heal the immune system, so that we're not just playing a big game of whack-a-mole going after these tumors. So it's a lifetime of vigilance, of hopefully long times of respite, and additional treatment and maintenance. But it's not. We all do what we have to do, right? But I call myself a reluctant warrior. I mean, it isn't as if I want to change my eating habits or take a lot of pills every day. But we all do what we need to do to thrive and to stay alive. And I have found that VVSMD has been the very best solution for me in doing that. First of all, like Dr. Google would tell me, I would have been dead a year ago, right? And I am not dead. I am thriving. I've worked full time the whole time. I got married last year. I had recently moved to a new state when I was diagnosed, and I've continued to make new friends. I'm living a full, productive, dynamic life, and I don't think people think that people with cancer are doing that. So I do think that is it's actually a new phenomenon for employers too, I'm finding, because they're like, really, you haven't missed a day? Well, I'm like, well, when I was hooked up to chemo, I did miss that day, but no, I really haven't. I mean, I don't really call in sick. People ask me many times if I have advice for someone who's newly diagnosed with cancer, and that's a loaded question because we're all on a journey, and each journey is different. However, I am grateful that from the very beginning I never had a why me moment, and I'm not sure why I didn't. It would have been very understandable, and I completely understand if others do. But in my mind, this is happening to others every single day. And so it was more of a why not me? But that also opened up the door to a type of thinking that was a why not me be healed? And so that's really what I threw myself into, was a journey toward healing, trying to figure out what I needed to know, what I needed to do, who I needed to talk to just figure out what that next right step was. Because I am not a medical person. And I knew that I was going to need to find the right medical people to be alongside me during this journey. I have greatly enjoyed my traditional oncologist. He fully admits that he cannot help me in the same way that Dr. Von Schaefer can. The tools are simply not available to him within the traditional realm. And I'm so grateful that somehow through books I read, people I met, and a random run-in that a friend had with an old friend who just happened to be in treatment with Dr. Von Schaefer, who led us here. And for me, that was the next right step. And so I would just say to continue to research, continue to look for the next right step for you, and to try to surround yourself with people who are hopeful, who are encouraging, who are trailblazers, and to have your best interests at heart. When I was first diagnosed, it made sense to me to look to traditional medicine because I didn't really know anything different in the cancer world. I knew about integrated health and holistic health related to things like my rheumatoid arthritis or ways to deal with, other types of pain, but I'd never really considered it for cancer. And so I wish that I had known at the beginning that there was a whole other world about cancer that was that it's very hard. It was very hard to find. It was actually ridiculously hard to find information about. And I do hope that that changes in the future. And I believe that people like Dr. Virginia Von Schaefer are changing that. They're changing that storyline, and they're basically writing the story so that we can understand that cancer is a metabolic disease. It is not something that we can just cut, burn, or poison. It must be treated at the cellular level. And if it isn't, then our bodies are not going to heal, and our immune system is not going to be able to do the job that it was created to do. And so what I appreciate about VVSMD is, in addition to providing low-dose insulin-potentiated chemotherapy, which is breakthrough in its own right and very difficult to find, we're also concentrated on healing my body at the cellular level so that ultimately my immune system can be healed, create an army of like-minded immunity cells that will be seeking and destroying my particular type of cancer. That's the goal, is that my body would be healed to do what it's created to do.